At the core of every healthcare professional is a commitment to managing the tumultuous waves of crises. In the realm of mental health emergencies, the fusion of empathy and expertise becomes the cornerstone for recovery. A sudden onset of symptoms, despair, anxiety, or withdrawal, signals a mental health crisis, where prompt recognition is crucial for guiding individuals back to safety. Patients, engulfed in a shadowed reality, rely on healthcare professionals for guidance through their most vulnerable moments. As we advance into the narrative, remember the significance of your role. You are the steadiness in their storm. Your compassionate presence lays the groundwork for the strategies and practices we'll discuss to offer solace and restore balance. Nurses stand vigilantly as the frontline defenders of mental health, a beacon of responsibility extending beyond medical care. They exhibit a keen perception, discerning the subtle cues of the mind in distress. Their communication, a soothing salve, is uniquely tailored to comfort and bolster trust. This segment honors their steadfast dedication to crisis intervention, a hallmark of hope. Their astute assessments can redirect a mental health crisis's course. By observing and acting, nurses reflect proactive care's impact and embody the irreplaceable fabric of the healthcare system. Moving forward, we will focus on the art of de-escalation, where nursing communication skills become the fulcrum for easing suffering and restoring calm. In the fragile quietude of a crisis, nurses curate an atmosphere of tranquility, knowing well that peace is not a luxury but a necessity. They carefully wield their influence through verbal and nonverbal communication, ensuring each action conveys safety and compassion. When verbal reassurances reach their bounds, medication may be considered cautiously, underscoring the gravity of this decision. We will now examine how collaboration and patient-centered care form a layered support network, using the tools and insights we've gathered as stepping stones toward proficient, empathetic intervention. In the midst of a mental health crisis, interdisciplinary collaboration steers the course of comprehensive care planning. Nurses, in harmony with other professionals, co-create a patient-centered treatment approach solidified by shared goals. The patient, placed at the heart of this collective effort, is empowered and heard. This integrated approach lays out both short-term benchmarks and long-term ambitions, crafting resilient pathways to recovery. As we transition to discussing the ethical considerations in mental health nursing, we maintain that collaboration is indispensable. At the intersection of crisis intervention, we safeguard the sanctity of trust and respect. Upholding our patients' autonomy and dignity is fundamental, transforming informed consent into meaningful dialogue. We advocate for confidentiality, protecting individual privacies with honor, and ensuring compliance with legal standards. As we venture into the upcoming discourse, let's embody the principles of ethical care, a framework vital to navigating crises with integrity and skill. Amidst turmoil, a nurse's prompt and assured response is essential. Grounded in safety, their actions reflect meticulous risk evaluation and adherence to established protocols, laying the groundwork for urgent intervention. These measures safeguard the well-being of all, emphasizing the nurse's calculated response to preserve dignity. As we proceed, we'll delve into medication management intricacies, contemplating how nurse judgment steers patients towards stability, always with a profound commitment to safety at the forefront. In the core of crisis intervention, nurses carefully oversee medication management, a task requiring thoughtful consideration of psychopharmacology. They champion patient adherence, facilitating an understanding of medication efficacy and managing potential side effects. By educating and monitoring patient responses, nurses ensure that treatments balance well-being with therapeutic outcomes. Next, we'll investigate the networks that bolster recovery, emphasizing that overcoming crises is a collective endeavor. The recovery journey weaves together care from various quarters: family, community, and medical professionals. Nurses bridge treatment and family engagement, fortifying patient progress in their environments. Community resources and follow-up care strengthen the continuous thread of support, reinforcing the permanence of recovery. As we transition to case studies, we carry with us the understanding that healing is the product of a compassionate embrace from a support system working in unity. The tapestry of our exploration now incorporates case studies, offering a window into the lived realities of nursing in mental health crises. Each case provides valuable insights into best practices, epitomizing the confluence of theory and action. These stories, from de-escalation to collaborative planning, highlight the practical application of our strategies, serving as a guide for mental health advocacy and compassionate care. As we progress, these narratives will light our path through continued commitment and learning. In our conclusion, we revisit the strategies vital to managing mental health crises. We've equipped ourselves with potent tools, ready to make meaningful impacts. The true essence of this intervention lies in balancing expertise with compassion. Embrace your dedication to lifelong learning. It empowers your growth and enhances support for those in need. Every opportunity to learn is a chance to enrich the lives we touch. Continue to seek knowledge as it leads you towards new horizons in mental health care, creating a legacy of hope and healing with every patient encounter.